الرحمن الرحيم مالك يوم الدين إياك نعبد وإياك نستعين اهدنا الصراط المستقيم صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين وقضى ربك ألا تعبدوا إلا إياه وبالوالدين إحسانا إما يبلغن عندك الكبر أحدهما أو كلاهما فلا تقل لهما أف ولا تنهرهما وقل لهما قولا كريما واخفض لهما جناح الذل من رحمته وقل رب ارحمهما كما ربياني صغيرا ربكم أعلم بما في نفوسكم إن تكونوا صالحين فإنه كان للأوابين غفورا.
Subhanallah. These are the verses recited from Surah Al-Fatiha and Surah Al-Isra, ayah number 23 to 25. The meaning of these verses are, in the name of Allah, the most beneficent, the most merciful. All praises are due to Allah, the Lord of the world, the most beneficent, the most merciful, Master of the Day of Recompense. He alone we worship, and He alone we ask for help. Guide us to the straight path, the path of those whom which you have bestowed favor, not of those whom which you have evoked your anger, or of those whom which you have who went astray. And your Lord has decreed that you not worship except Him, and to parents good treatment. Whether one or both of them reach old age while with you, say not to them so much as an of, and do not repel them, but speak to them a noble word. And lower to them the wing of humility out of mercy, and say, My Lord, have mercy upon them, as they brought me up when I was small. Your Lord is most knowing of what is within yourselves. If you should be righteous in intention, then indeed He is ever, to the often returning, forgiving.
Jazakallah khair. Briefly, I will talk a little bit about Baba, and I will give a different perspective as a son, as well as somebody who has seen him at his craft, that is as a surgeon. I have not prepared anything, and I just, memories come flooding to me when I think about it. My first, I'm from Osmania Medical College, batch of 88, and by the time I started my medical college, Baba had already retired. I first got exposed to his surgery, or what he's known best for, when I was assisting him after I came into medical college in our hospital, JJ Hospital, which he ran for many years successfully. And I saw that here was a man who knew the human body like the palm of his hand. Not just he knew a normal anatomy, he knew all the variations of a normal anatomy. And that made him an exceptional surgeon. He was blessed with the surgical skill that very few people possess. One of the important things that he used to do is rarely use the surgical cautery, which actually is like a little burn that you cause to stop the bleeding. very meticulously, he used to tie every small blood vessel. Now, that would create a little longer surgery, but I have never seen his operations ever get infected. And this I'm talking about back home in Hyderabad, where we did not have any of these advanced airflow, reverse airflow, and all these filters, air filters that the modern surgical theaters in America use, and I keep on seeing infections developing. The other thing that I remember him was he was a very meticulous dissector of the operative field. He used to meticulously, taking his time and patience and knowledge, used to remove. It may be a cancer, it may not be it may be something else. He used to remove everything out of the body that should be taken out, and then he would send the patient for chemotherapy, so on and so forth. So he used his clinical judgment many a times where there was no diagnostic testing available. Like in Hyderabad, we hardly had any CAT scans. We did not have any MRIs, but he was blessed with the surgical and the clinical skills to make him stand heads and shoulders above the physicians that I have seen. And sometimes I even think that in America, when I did my residency and training, I have seen people rush in the operations and then have some complications which I saw Baba avoided by taking time. So that's one thing that really struck me, and sometimes I feel that I really missed his early era of surgery where he was in Osmania, where he was a little younger and he would take bigger challenges. The other aspect of his surgery was he was very good with his patients. May be a very poor rickshawala, or it may be minister's damad or somebody like that, and they would all be treated very well. And the proof is that when he retired, a lot of people actually used to fall at his feet when he was leaving Usmania. I truly feel very blessed to be his son, and one of the big regrets of my life was that we as a family could not continue the surgical tradition in our family, which because of family pressures, and we wanted to explore the new world, America beckoned to us, and we could not continue the surgical legacy of our father. But hopefully my kids or one of us over here, they can carry on the legacy. Thank you very much. Will say a few words, inshallah.
Assalamu alaikum. It gives me great pleasure to welcome all of you, doctors, friends and relatives. It is a very happy occasion to share some of my experiences with you. I joined medical college in 1948, and at that time some of my friends were rather terrified with the sight of cadavers in anatomy hall. Two of them were there just to leave the medical college, but they changed their mind later. I was the student very much interested in anatomy, and I developed fascination for the study of human anatomy. And at that time, it was 2 years for basic sciences, anatomy, physiology, biochemistry. And now it has been curtailed to 1 year. I have got my own reservations on that, whether we are doing justice for it or not. After 2 years, the clinical medicine started, and there was a lot of stress by our teachers on the history taking, clinical exam, initiating physical science, making diagnosis, 3/4, and out of that excluding one after another and coming to provisional diagnosis. And investigations were there just to confirm the diagnosis. And you may ask, were you correct in that? And good number of times we were correct, even though the investigations were very few. And the investigations were there for confirmation. And 2 years later, I left for UK for FRCS, and I saw the same system of education where there was a lot of stress on the history taking, clinical exam, making provisional diagnosis. Same atmosphere was there in Royal College. And the student was assessed only on this basis in the Royal College exams. And I did my surgical training for 2 years after fellowship, and same thing I noticed in the hospitals also. When I came back to my country, I worked as assistant professor for 4 years and later as professor of surgery for nearly 20 years. I tried to inculcate the same thing in my students. Nowadays, the setup is changed, even though the surgeon of the present day is blessed and very fortunate to have battery of investigations, but the surgeon is neglecting the basic thing, the history taking, clinical exam, and making provisional diagnosis. He is depending more on the investigation, and it is more like a computer which gives the diagnosis. Whether we are doing justice for that, and I think if there is a blend, if these two things are blended, the old system of education and the present battery of investigation, if these two things are blended together, the surgeon will get glorified, definitely. And now, I did my basic training, surgical training in UK, and when I was working in India, I was posted for about 4 months in cancer hospital, and there I was referred carcinoma rectum, and I started doing abdominal perineal resection even though I did not see it before. It was all because of the systemic education, the way the things were taught, basic anatomy and the surgical skill. And similarly, when I recollect, when I came to Osmania, I recollect Dr. S.R. Rao, Shankur Ramchandra Rao. He referred a case of